The first speaker is Dr. Ayushi Choudhary, and presenting deep learning classifier for screening and diagnosis of diabetic retinopathy using a simultaneous fundus and OCT images. Is Dr. Ayushi Choudhary here? Okay, great. All the best. Thank you, Tinku ma'am.
Good afternoon, everybody. I'm going to be presenting a deep learning classifier for screening of diabetic retinopathy. So the problem that we are trying to address is the increasing loads of diabetes and hence the need for diabetic screening. In India alone, there are more than 73 million people who are diabetic. It is said that out of every diabetic, every third diabetic has diabetic retinopathy, and every 10% has a vision-threatening diabetic retinopathy. But because of delayed referrals and lack of adequate healthcare infrastructure at the primary healthcare level, the screening is impacted. So we wanted to make a model for early diabetic screening, which can be implemented at ground root levels and is an easy, reproducible modality, which can be accessed and implemented by even untrained personnel, staff, or even physicians. So for this purpose, we made a deep learning classifier which used simultaneous imaging with a fundus camera and an OCT imaging for screening of the retinopathy. So we used about 3,165 fundus images and 4586 OCT frames from 629 diabetic retinopathy patients who were visiting our center. All these images were annotated separately by 2 retina specialists. Then these images were fed to a deep neuronal network screening model which classified these images as normal and abnormal. Abnormal pathologies from these scans were extracted as image patches, which were then fed to a pathology model and which classified these abnormal images into various things like fluid-filled regions, hemorrhages, hard exudates, or traction, which helped us classify the patients into a referable or non-referable pathology. So this was our general working of our AI system, which used the input from a OCT and a fundus camera, first which was processed through a gradability and localization network, which localized the areas of pathology, and then it classified, it went through a classification network, which classified it as a referable or a non-referable pathology. Referable was, for us, we had classified it as a severe non-proliferative or a proliferative diabetic retinopathy or patients with diabetic macular edema. These were the fundus photographs that we used. The hotspots were marked, and as you can see, the abnormal images like hard exudates, neovascularization, or laser scars were identified by the model. And these are the localization maps for fluid-filled areas and epiretinal membranes that the AI model can now recognize. So using this model, we saw that the precision and the sensitivity for grading the non-proliferative and proliferative diabetic retinopathy was approximately 0.9 and above, while the sensitivity was a little less for mild diabetic retinopathy. For severe and proliferative stages, the AI was comparable in identifying these sources. This is the ROC curve for the fundus images and the precision and recall values for different pathologies that was seen. So I would like to conclude by saying that this deep learning network was successful in our primary, in our ground root level to identify abnormal images, and this platform achieved a good performance, especially when using the fundus camera and the OCT images simultaneously. So we feel that this can be used later for screening in a primary healthcare setup. We want to probably put it in use this method with different other machines. We use a Tritron OCT and fundus camera right now. We want to use and see if they can be used with handheld OCTs and fundus camera, and if this can be applied by the untrained staff and personnel. This is what we are working on. It can also identify the drusen's in ARMT. We need to work on it and develop it further. Thank you.
Dr. Ayushi, definitely a very good work, no doubt. I have some questions. Was your output based on both fundus images and OCT?
We did both ways, ma'am. We did separately also, and separately also both of the, individually both modalities were successful, and when we combined, the results were showing higher precision values.
Fundus photograph and its utility to diagnose referable versus non-referable is quite well known.
Yes, ma'am.
What is the possible implication of using this for OCTs?
Ma'am, two things that we concentrated on was macular edema, showing the fluid-filled regions or intracystic spaces, and the second thing was epiretinal membranes that we were able to localize, which is not entirely related to the retinopathy, but we could say, and then could be correlated to the visual acuity and referred accordingly.
I mean, so far AI has been used in something like screening purposes, wherein fundus photos are being screened, and we are trying to determine and reduce the burden on an ophthalmologist by screening via fundus images and AI and diagnosing the referable ones. Only those come. We don't need to screen all the diabetics. So, but an OCT is a specific investigation done by an ophthalmologist. So how does an AI analyzing an OCT help?
Ma'am, definitely a Triton OCT will not be there for a primary healthcare, but if this can be applied to home-based OCTs, handheld OCTs, then we could implement it at a physician level or a primary healthcare level.
So in an earlier session where I was here, one of your colleagues presented a model of a simpler OCT model.
Simpler OCT,
You should try this out on that.
We plan
Then
to
you
do,
have
ma'am.
something that's worth talking about. Good work. Thank you.
Can I ask one question, please? You mentioned about screening model and pathology model. So
Yes.
which models were used? What software was used?
So the software name I don't know, but the
And is that model specific to particular fundus camera and OCT machine, or that can be used on any machine?
so we have tried it with the other OCT machines also that we have with the Heidelberg OCT, but the maximum data that we have, because we started working on Triton, that's the data that I've represented, but we have tried it with other ones and it has been successful.
Thank you. Thank you.
Thank you, Ayushi, for your nice presentation.